Let me begin. Good afternoon, everyone. My name is Alex Stone, and I am the Government Affairs Director for the Oncology Nursing Society. We represent the interests of the 110,000 U.S. oncology nurses. And for the past 2 years, we have held almost 100 virtual events, bringing expert nurses to policy leaders to better understand the impact and support that providers and the profession, and of course, the patients have as we move forward. Symptom management education, patient-centered care, evidence-based practice, these are priorities for oncology nurses, and this educational segment is in collaboration with the Lymphedema Treatment Advocacy Group, a patient advocacy organization. I'm a little humbled to tell you that it was really started by a mom for her son, and it has turned into a huge bipartisan legislative effort. And ONS has been proud to be a small part of this with our congressional champions. But the real champion is that mom who never stops fighting for this cause. And that mom is Heather Ferguson, who has worked with U.S. representatives and champion Jan Schakowsky and Representative Buddy Carter, who are at the table and will be with us today. So we are thrilled to do that. At this point, I'm going to turn it over to Heather herself to give us some introductions. Heather, on to you.
Thank you so much for that nice introduction, Alec, and thank you everyone for joining us today. Before I turn things over to our congressional champions, I'm going to give you some very brief background on lymphedema and the bill for those of you who are new to this issue. Lymphedema is a chronic disease and can be caused by any permanent impairment to the lymphatic system. Although it is most commonly associated with the swelling that it causes, the physiological changes are actually far more profound than simply swelling. Most importantly, because our lymphatic system is a key component of our immune system, lymphedema patients are at high risk for infections, which often require IV antibiotics and hospitalization. The cornerstone of treatment for lymphedema is prescribed medical compression garments. Unfortunately, Medicare has been unable to cover these items due to lack of a benefit category. Therefore, the Lymphedema Treatment Act is a simple bill that will make a technical correction to the Medicare statute to enable coverage for these vital medical supplies. The bill currently has 356 House and 74 Senate co-sponsors, making it the most supported healthcare bill currently before Congress. It was recently unanimously advanced out of committee in the House and just received a CBO score. I will speak in more detail about these things later on in our program, but without further ado, I'm so pleased to turn things over to our congressional champions. And speaking first will be Congresswoman Jan Schakowsky, who is the lead House sponsor of the Lymphedema Treatment Act, followed by Congressman Carter, and then the health aides for our Senate champions. So Congresswoman Schakowsky, thank you so much for taking time out of your busy schedule to join us today, and the floor is yours.
Thank you so much, Heather. Heather Ferguson, you are a champion, and thank you for getting this started and bringing us to this moment. I want to give a great shout out to the Lymphedema Advocacy Group and the Oncology Nurses Society, and really and all the advocates who have done so much work. I am really proud to champion, along with my colleague and friend, Congressman Buddy Carter, the Lymphedema Treatment Act. We introduced the legislation in May of 2021. And as you heard from Heather, we now have 356 co-sponsors, and many in the Senate as well. And those of you who are familiar with the Congress know we have more than enough to actually pass this bill. So in September of 2022, the bill received a CBO score of $570 million over 10 years. So divide that by 10. We are not talking about a lot of money to address this really serious ailment. and we are actually, the CBO acknowledged that it would actually save more money for Medicare in the long run if we pass this bill. We'll get more into it. So lymphedema, is a painful and debilitating disease, and as Heather said, it often develops after cancer surgery. And actually, this is October is still Breast Cancer Awareness Month. And the fact is that 2 out of 5 breast cancer patients will develop lymphedema within 5 years of surgery. So we have an opportunity to really help so many people. Right now, Medicare and many private insurance companies as well do not cover compression garments for lymphedema, and that lack of treatment can cause really life-threatening infections. It's very important. So the treatment for lymphedema is in fact these compression garments. So our bill, Buddy Carter and my bill, will directly help 3 million, actually up to 3 million. There may be more than 3 million too, people on Medicare to be beneficiaries of this treatment. And I am really grateful to the chairman of the House Energy and Commerce Committee, Frank Pallone, and for our ranking member, Kathy McMorris Rogers. So we have bipartisan support getting that legislation out of committee, and all of the members on both sides of the aisle who are supporting it. So there really is no reason why we shouldn't be able to move swiftly. And I know with all the people that are on the line and all the advocates and all the supporters that we have in the Congress and well beyond, that we should be able to do it. So let's get going and get it done. And I thank you and yield back.
Thank you so much, Congresswoman Schakowsky. I know I speak on behalf of millions of patients because my son is one of them, that your passionate and strong leadership on this bill, it means the world to us. And we are really hopeful that this is the year the bill gets across the finish line. So thank you for your leadership. And next up, we're pleased to share with you a video from Congressman Buddy Carter. He had hoped to join us in person, but had a scheduling conflict. So he did share with us these remarks.
Hello, my name is Buddy Carter, and I have the honor and privilege of representing Georgia's 1st Congressional District in the U.S. House of Representatives. I serve on the House Committee on Energy and Commerce, which has jurisdiction over all health-related matters. As a pharmacist for over 4 decades, I've gained a unique insight into our healthcare system and the challenges patients face. One area that I'm particularly focused on recently is the gap in care for patients with lymphedema. Nearly 5 million Americans suffer from this disease, the majority of whom are cancer survivors. Currently, there is no cure for lymphedema and no pharmaceutical treatment. The only existing option for these 5 million Americans is to rely on compression garments. Unfortunately, Medicare is currently unable to provide coverage for these vital supplies due to lack of a benefit category. As a healthcare professional, I came to Washington to make a difference and help those suffering. That's why I'm the lead Republican on the Lymphedema Treatment Act, which will finally close the gap in Medicare coverage for people living with lymphedema to cover those essential compression garments. I'm proud to say that this bill is one of the most bipartisan bills I've ever worked on, with over 350 co-sponsors in the House and 70 in the Senate. This is just one example of what we're capable of when we work together, and I look forward to seeing the bill come to the floor and pass out of the House. To the patients suffering from lymphedema, help is on the way.
Great.
Fantastic. Yeah, we are so thrilled to have such strong support on both sides of the aisle. And now we're going to head over to our Senate champions. Senator Cantwell is the lead sponsor of this bill in the Senate, and I would like to welcome her health legislative aide, Kevin Chang.
Thank you, Heather. And thank you, Representatives Chakowski and Carter, for your remarks. And thank you for giving us the background of the bill. My name is Kevin, and I'm the legislative assistant for healthcare issues for Senator Maria Cantwell of Washington State. Due to scheduling constraints, the senator will unfortunately not be able to join us today, but Heather has kindly given me the opportunity to talk about the Lymphedema Treatment Act. As we dive into the policy itself, I also want to take this time to recognize October as Breast Cancer Awareness Month, and also to honor a late constituent of Washington State, Elaine Eggman, who lent us her story and gave us the motivation to introduce this bill. Elaine was a breast cancer survivor who also lived with lymphedema for over 20 years. She, like so many others who suffer from lymphedema, realized that the lack of access to compression garments, driven by the fact that Medicare simply doesn't cover them, was a great obstacle for patients who want to live full and productive lives after beating cancer. Elaine met Heather at a conference where she shared her journey that eventually reached Senator Cantwell and led her to champion this cause in the Senate. Elaine sadly passed away in 2019 after her second battle with breast cancer. Even though she is not physically with us today, her story and legacy lives on in hopes that one day breast cancer survivors wouldn't have to suffer from lymphedema and are able to live healthier and more fulfilling lives with compression garments. The Lymphedema Treatment Act, as we mentioned, is currently the most supported bill in Congress, with 74 co-sponsors in the Senate and 356 co-sponsors in the House. And I personally think that is incredible. So thank you, Heather, other members of the Lymphedema Advocacy Group and the Oncology Nursing Society. Thank you to everyone who is on this call with us today. And I hope today's session can provide you with the information you need to help us get this bill across the finish line. Thank you.
Thank you so much, Kevin. And we're so grateful for Senator Cantwell's leadership on the Senate bill. And now I'm going to turn things over to Nick Potabaum. He is the health aide for Senator Grassley, who co-leads the bill in the Senate.
Great, thanks, Heather, and thanks for those who have joined. As a fellow Iowan, I know there's probably some other Iowans that have joined today, so thanks for joining as well. I don't want to repeat too much of what folks have already said, but just on behalf of Senator Grassley, thanks for individuals' advocacy and work on this legislation. As mentioned, if you don't know already, this is one of the most supported bills in Congress, including 74 co-sponsors in the Senate, and so that's not an easy feat, and it means that there's been a lot of work going into putting support for this bill, not only this Congress, but several Congresses before that. Senator Grassley is a former chairman of the Finance Committee here in the Senate and knows all too well the importance of building strong bipartisan support for legislation. And the fact that we've got a Congressional Budget Office score as well proves that we've built a lot of momentum for this legislation, and hopefully we can get it across the finish line this Congress. I'll just end with a quick story. Senator Grassley knows the importance of not only preventing breast cancer, but also the importance of treatment, as mentioned earlier. And so obviously compression garments are a key piece of that treatment and recovery. And so Senator Grassley's wife over 30 years ago had a personal victory over breast cancer. And we know that it's just so critical to have the Lymphedema Treatment Act passed to provide that necessary treatment and making sure Medicare Part B covers compression garments. And so just appreciate everyone's support, but also continued work and advocacy as we try to get this bill across the finish line this Congress. Thank you.
Thank you so much, Nick, and thank you again for Senator Grassley's leadership. And now I'm going to turn things back to Alec, who's going to introduce our other panelists.
Thank you, Heather. And I mean, really, a shout out to Congresswoman Chakowski and to Congressman Carter and to those Senate offices, bipartisan, bicameral, in this environment. This is really a unique piece of legislation, and it really says so much about their leadership. So ONS is thrilled to work with all of these offices, and we, since the Congresswoman is here, we thank you very much for your leadership in spearheading this as we move forward. Really, we are all very hopeful as the sands run out here that this one might be able to get across the finish line. So thank you so much for your leadership.
Let me just say also thank you to Congressman Cantwell and to Congressman Grassley for, we need the Senate. So I'm really happy about that. Thank you.
Well, we are thrilled. Thank you so much. We are greatly appreciate your hard work in getting this congressional session after session. We're hopeful this time.
Yep.
Yes, ma'am. Thank you. I'd like to tell a quick story. ONS has been engaged with Heather and the Lymphedema Treatment Advocacy Group for more than a decade. And I don't know if she recalls this story. I'm sure she does, that we were sitting in the pre-COVID in the Congressional House, must have been the Longworth building, having a cup of coffee. And the serendipity of politics is such that 2 seats over, Chairman Pallone was sitting having his lunch, and we sort of got his attention respectfully and waited till he was done and said, Mr. Chairman, we're on our way up to your office. And so before that, Heather got a few minutes to speak to the chairman himself years ago. And I think that is part of this issue. Her passion for what we're doing here really made an impact with the congressman. And I think he has been a supporter because of the congressional bipartisan support here and because of her passion in that. So it's just an interesting dynamic of how these things, all politics is local, and having a cup of coffee in the congressional office there really makes a difference in having those patient advocates move forward. So with that, I just, wanted to give you all a shout out as to what Heather is doing and how much it means to her. So we're going to have this panel discussion. And I'm going to very briefly announce the 4 speakers, and they can jump on here if they will. It's Sarah Bramlett, MSHL, and she is the board chair of the Lymphedema Advocacy Group, as well as a lymphedema patient and Medicare beneficiary. Carrie Stewart, RN, MSN, OCN, is the Director of Cancer and Lymphedema Services for a large nonprofit healthcare organization in Northern California and has over 20 years of experience as an oncology nurse. Valerie Nauman came to her work in the breast cancer space after the death of an aunt who passed away from metastatic breast cancer and continues to fight to this day as a senior specialist for federal policy and advocacy at Susan G. Komen. And of course, Heather Ferguson is the founder and executive director of the Lymphedema Advocacy Group and also the mother of a child with lymphedema. So with that, I'm going to get my screen here for our panelists to jump in there. Heather, everyone is going to sort of present a little bit on their own, and then we'll have a little Q&A, and we're happy to take any questions that come through the chat, and we'll monitor that. And at the end of the presentations, happy to do a little Q&A. Heather, you're up.
See, we're going to be starting with Sarah. So Sarah, you're on.
Hi, and again, my name is Sarah Bramblett. I'm the board chair. I have actually filled Elaine's shoes, which are very big and quick shoes to fill, especially in walking the halls of Washington, D.C. As it was mentioned, I am a Medicare beneficiary, and I know I don't look like your typical Medicare beneficiary, but as you can see, I do have lymphedema. I have my first slide has the pictures of when I was first diagnosed. That is December of 2001. I was 24 years old. As you can see, I had a very advanced stage of lymphedema. I do have a secondary to lymphedema, but of course, lymphedema is a primary condition. So like Heather's son, I have lower extremity, non-cancer related lymphedema. I'm not really quite sure how I could walk at that point. After that was the day of my diagnosis in 2001, and I did start with a compression pump and manual lymph drainage and compression wrapping. I did this 2 to 3 times a week. It depends on, my schedule. At that time, again, one wanted to be employable and educated. I was on Social Security or supplemental security income and on Medicaid. It was a very difficult time as I was going through the process to reduce the size of my legs. I had frequent cellulitis. I was in the hospital 2 or 3 times a year for IV antibiotics, and it reached a point where the doctors actually put a Mediport in because I had needed antibiotics so frequently, and they wanted me to be able to get that at home. Ironically, the Mediport got infected, and I had to have that removed. As I said, my goal was to be employable and educated, and I actually got my first professional job in 2004, and that's the picture you see with garments on. These are my first garments I got in December of 2004. I was so happy to have a real job, and I moved to Miami, Florida, had a real job with real insurance, and then I found out that insurance was a battle to get coverage. Now, with education through my therapist and some vendors, I did get them covered. It has always been a battle, and I've never gotten 2 pair every 6 months as recommended, because usually you want the first pair, make sure they're measured correctly. And by the time we got the first pair paid for, we would be time to get new measurements before we could order the second pair. But I have to say that those garments I got in December 2004, I went nearly a decade without cellulitis. I did, so that was 2004. In 2012, I had a mild case of cellulitis. With the change in, my jobs changed in 2009. I got laid off like many other people, and I actually kept COBRA and was able to maintain my health in order to get a job. I got a new job in 2011. Things ended, and just get to the point in 2013, I was no longer employed because I had always been working disabled. And I had enough credits. That's when I was on Social Security disability income and a Medicare beneficiary in 2013. And that is when I realized I had lost my access to compression. While it had always been difficult to get, at least I was well versed in appealing to insurance companies and winning approval for them. But with Medicare, that coverage just doesn't exist. And I did in 2016, the next slide, you'll see in 2016, I had actually purchased a pair of compression out of pocket and submitted the claim to Medicare for reimbursement. And of course, I was denied, and I fought the process through the entire system. I even had an administrative law judge hearing, and then that was also an unfavorable decision. And so next I appealed to the Medicare Appeals Commission. And my next slide will show what their decision was, if we can advance to that. So as you can see, this was the final decision, and I actually scanned and highlighted this. This was in their final decision, that there's no doubt that the appellate needs the compression garments to treat her lymphedema. And furthermore, we have no doubt that compression garments are considered standard practice for the treatment of lymphedema, which makes the appellant's arguments compelling and her situation sympathetic. However, because Medicare is a defined benefits program, the compression stockings at issue are not covered because they do not fall under a defined benefit category. So this is, I joke that I have beat every insurance I've ever had coverage from. And while this might seem like a defeat, passing the Lymphedema Treatment Act will be my victory over Medicare. As I mentioned, since 2013 and being on Medicare, my health has actually declined. On the next slide, you'll see it especially was difficult during COVID. I actually had cellulitis in late February 2020, and during my last trip to DC, which was March 2020. And it wasn't getting better. The problem was typically when we have a flare, you can see the excess swelling I had from the cellulitis. And although my leg was a lot more red, but I think my iPhone kind of filters it out because they think they're helping. But typically when a patient has a flare-up, you get physical therapy to help reduce it, or I live in Miami so I can get in my pool. And those types of extra care weren't available due to the pandemic. Things were closed down. So I had cellulitis that began the end of February, and into April, it still had not gotten better with oral antibiotics, and I had to go to the emergency department. I actually thought I would be admitted for IV antibiotics. That was my plan. However, they were also limiting unnecessary, or, you know, if they could possibly not admit you because they were over, the hospitals were so full that they didn't want to admit me. So they gave me a very high dose, powerful antibiotic IV and sent me home. But you can see the cost, not the, you know, you can see the large number that the hospital billed Medicare. But even the highlighted part, just what Medicare paid and what my out-of-pocket would have been or would have paid for an entire year of compression garments for me. And I need the custom, so I do wear the ones that are more high end. And so this just makes financial sense. It also makes financial sense, you know, I'm on disability. I have a master's in health law. I actually changed, I used to work in higher education. I changed courses because of all the experience I had. The degree certainly helped me in advocating for myself, but I would much rather be able to work full time again, as I did when I had access to compression. It's just very frustrating. I mean, looking at these pictures, you can tell I'm a little upset. It's very frustrating to look at the pictures from 2004 and to know what my current status is, because I worked so hard to get to a point of health, and being on Medicare, I've lost some of that progress that I have made. So I really, this bill, you know, I volunteer in this organization because this bill literally is life or death for me. Thank you.
Thank you so much, Sarah. Whenever you're ready, go ahead, Carrie.
Hi, everyone. Thank you so much for your time today. My name is Carrie Stewart, and I'm the Director of Cancer and Lymphedema Services for a large hospital here in Northern California. I'm also a member of the Greater Sacramento chapter of Oncology Nursing Society. And before I get started, I just want to thank Congresswoman Schakowsky for her work to secure healthcare for all Americans and for her work on this bill. I think that this will drive home some of the points that she made, that we're either going to pay for it one way or we're going to pay for it another. But really thinking about what would we rather do? Would we rather pay for it up front when it's small, or would we rather pay for it on the back end when it's really big? So Heather, if you would go ahead and advance, or Jen. All right, so starting here with the cost and current state for the patient expense, following up with Sarah and her legs, I wanted to look at the cost of supplies for one leg up to the thigh. And the way it works is, she said, when you get started in treatment, you have to do bandaging every day for 2 to 3 weeks to decompress that fluid in the tissue and soften the skin up. After that, you move on to a garment. But essentially for bandaging and then the garments, whether it's ready to wear, which would cost about $90 for a 6-month lifespan, so about $200 for a year. The Velcro compression wrap, $350 for a 12-month lifespan, or custom garments, which start at $350 but can actually go up to, I've seen, $1,000 to $1,500. We're looking at a few $1,000s for one leg, and some patients also have 2 legs, but wanted to show you the supplies that we start with in the bandaging. So that's what that photo is there. That's that $200 cost that patients have upfront out of pocket. Could we go on to the next slide, please? Thank you. So then I wanted to talk about what it looks like on the back end and what we eventually end up paying for, as Sarah also spoke to. So I chose 3 patients to look at that we admitted multiple times over the past year, specifically because they did not have the bandages and the garments. They could not afford to pay for them. So instead, they were admitted on multiple occasions. So let's go to the first case study. I think that's the next slide. So this is our first patient, a 76-year-old female with a history of cervical cancer. She lost some of her lymphatic drainage due to a surgery that she had and ended up with a stage 3 lymphedema of the right leg. And that's similar to what Sarah showed you first. So over the course of a year, from August of 2021 to August of 2022, she had 5 hospital admissions for a total of 23 inpatient days. Both her admitting and her discharge diagnosis were the same. So she went in with cellulitis, which is a skin infection. and it progressed to sepsis, which was a blood infection. And these can be very serious, very deadly. They can end up patients in the ICU, on life support, multiple antibiotics, lots of therapies later. The total cost of this hospitalization, and I thought everybody could write this down if you wanted to, was $278,871. So again, that's $278,871 for 23 inpatient days and 5 hospital admissions. Let's go to the next slide, please. Thank you. So this was patient number 2, and this hit home. This was not a cancer patient, but she's my age. She has a history of diabetes, asthma, high blood pressure. Those are all medical diagnoses we see in our friends and family all the time. She had stage 3 lymphedema of both lower legs. So her supply costs up front would have been double what I showed you. She had 2 hospital admissions from August 2021 to August of 2022 for a total of 7 inpatient days. Again, she had the skin infection and the blood infection resulting. The total cost of her 2 hospitalizations, again, you could write this down if you'd like, $99,803. So that's $99,803 for 2 hospitalizations. Next slide, please. And this is patient number 3. This is a 67-year-old male with a history of diabetes, high blood pressure, coronary artery disease. These are all things that we see in our loved ones and our friends all the time. That coronary artery disease is that plaque buildup that you get in your veins if you have high cholesterol, and that can cause lymphedema as well. So this gentleman, lovely man, stage 3 lymphedema, both lower legs. Again, 5 hospital admissions in the past year, total of 18 inpatient days, those nasty skin infections and resulting blood infection. Total cost of his hospitalizations, $296,074, if you want to write that down. Again, it's $296,074. So as you can see, having these numbers, I hope, will help as people are deciding whether or not this is the right decision and the right care and service and supply to provide to patients everywhere. So thank you for your time.
Thank you, Carrie. And go ahead whenever you're ready, Valerie.
Great, thanks. I just want to echo the thanks of my fellow panelists today to both our congressional champions, but also to everyone attending this briefing. It's really great to see such support come out. I really appreciate everyone taking the time to be here today and to listen to such an important issue. So as you've heard, I'm Valerie Nauman. I serve the breast cancer community as Susan G. Komen Senior Specialist for Federal Policy and Advocacy. And this is an issue that's just incredibly important to our community. Because of the site of origin in breast cancer on your chest, often cancer that has advanced will move to the nearby lymph nodes, which are under your arms. So we know that breast cancer patients and survivors often develop lymphedema because of surgery or because of radiation to these lymph nodes, but they also remain at risk for lymphedema for the rest of their lives because of their treatment. Breast cancer has kind of a way of touching us all, including Senator Grassley, as Nick mentioned earlier, and I'm sure many, many people on this call. But thankfully, the overall breast cancer mortality rate among women in the US has actually declined by about 41% over the past 30 years, which is fantastic. But as survivorship increases in breast cancer, we know that so too does the number of cases of lymphedema in our community. It kind of goes hand in hand. So it really can't be understated that 40% of the 3.8 million breast cancer survivors in our country will develop lifelong lymphedema as a result of their treatment. And when you look at this from a health equity lens, it's exacerbated even more with Black and Latino women far more likely to develop breast cancer-related lymphedema than their white counterparts. So it's a really broad-reaching community issue for us. We hear really often from members of our community that lymphedema is a source of considerable pain. And we've heard that from our fellow panelists today, but beyond that physical pain, there's reduced movement, serious infections, which Ms. Stewart just went through, emotional distress, which Ms. Bramblett so poignantly overviewed, and just the resulting reduced quality of life that lymphedema brings, all on top of the other issues that come with a breast cancer diagnosis. So it, not only is a big issue in our community, but it's pretty compounding in its impact. As many of you know, though, October is National Breast Cancer Awareness Month. Breast cancer is the most common cancer diagnosed in women in the US. 1 in 8 women in our country will develop breast cancer over the course of her lifetime. So with that many women facing complications like lymphedema, you can see how prevalent this issue becomes. And unfortunately, age is one of the biggest risks for breast cancer. The median age of diagnosis for breast cancer in the US is 63 years old, meaning a little less than half of all breast cancer diagnoses occur in women over Medicare age. So coverage for those medical compression garments, they're really critical. They're an essential cornerstone for treatment of lymphedema, but we also know that getting that coverage is a huge barrier for folks dealing with their survivorship care or dealing with their breast cancer. The financial burden of a breast cancer diagnosis can be absolutely crushing, but with additional costs from survivorship care, lack of coverage is a massive burden, especially when you think about the costs that, Carrie was going over just a few minutes ago. So we know that financial burdens can often prevent proper adherence to treatments, even if that could lead to other costly complications. If you're worried about putting food on the table, maybe a compression garment for your lymphedema comes second fiddle, unfortunately. And we want to make sure we're able to continue to allow our community to put their health first. So Komen has been incredibly supportive of the Lymphedema Treatment Act and grateful to Heather for all of her advocacy over the years. And I can just confidently say that this bill it's right for patients, it's right for the breast cancer community. And after years of fighting from advocates from our community and so many other communities just begging for care and begging for Congress to see them, the time really is kind of now to see this bill passed. So I will pass the microphone over to you, Heather.
Thank you so much, Valerie. And so as you can tell from listening to all of our panelists, closing this gap in coverage is long overdue, which is why we're so grateful that the Lymphedema Treatment Act has garnered such tremendous bipartisan support and for the progress that we've made in advancing the bill. On July 13th, the Lymphedema Treatment Act was unanimously passed out of the Energy and Commerce Committee. During the markup, numerous members from both sides of the aisle spoke in support of the bill. Soon after, the Ways and Means Committee waived their jurisdiction and the bill was placed on the House Union calendar. This means we are no longer able to add House co-sponsors, but we are still collecting Senate co-sponsors. So if you are joining us today from a Senate office not yet on the bill, I hope you will consider speaking to your boss about adding his or her name. Just a few weeks ago, the Congressional Budget Office gave the bill a 10-year score of $570 million, as you heard from Congresswoman Schakowsky. Knowing that CBO is generally very conservative in applying savings, we were glad to see that they did factor in a 30% reduction in lymphedema-related hospitalizations. However, multiple studies and an abundance of real-world data have indicated that the actual reduction in hospitalizations, which you saw are extremely costly, will be much greater than 30%. And there will also be reductions in physician and therapy visits, complications that require treatment but not hospitalization, loss of productivity, disabilities, and in other areas. So the CBO analysis just further strengthens our belief that enactment of this legislation will actually result in a net savings. And on top of that, an independent analysis performed by Avalier Health last year found that Medicare could save $1.3 to $1.5 billion, that's billion with a B, $1.3 to $1.5 billion every year through a reduction in lymphedema-related hospitalizations. But even more importantly, passage of this bill will give cancer survivors and others with lymphedema, like my son, the opportunity to live full and productive lives. As you've heard, I became involved with this issue because I have a 16-year-old son who was born with congenital primary lymphedema. When he was only 7 months old, he was prescribed his first set of compression garments. And I knew that these were the medical supplies he would need for the rest of his life. Unfortunately, I learned that our private insurance policy, like so many others, didn't cover these supplies because they aligned their coverage with that of Medicare's. So not only will this bill directly impact up to 3 million Medicare beneficiaries with lymphedema, it will also improve the health and lives of millions of other Americans who, like my son, are struggling to access the care they need for themselves or for a loved one. So we urge each of your offices to support this bill when it comes before you for a vote, which we hope will be during the lame duck session. And I'm so grateful that you took the time today to learn more about this issue. So as we move into our discussion period, I'm going to put some links in the chat that have more detailed information about the items that I've discussed. And I know we all look forward to answering any questions that you have.
Thank you, Heather, and thank all of the panelists. Really incredible, moving, and driving forces as we really consider this last. And I know I'm sort of harping on this. That the congressional calendar is winding down very quickly, and while there will be a special session, we don't know how that will go. So we are very, very hopeful. Again, I'll say Heather is putting links into the chat. If there are other questions in the chat from congressional staff or others, we're happy to take those as we move forward. But I will use the prerogative of the chair and the mic, if you will. And I have a couple of questions to ask. First to you, Sarah. I mean, such a compelling story. Having a chronic condition can also take a toll on a patient's mental health. Would you mind sharing with us any psychological impacts and emotional impact on living with lymphedema and the lack of access to care that that may contribute? We don't want to cross any lines here, but you've been very generous with your story, and it's so moving.
Yes, and as you can tell, even just repeating it or just going over it has brought up some emotions today. I think the most so cellulitis scares me. I mean, and as Carrie mentioned, it leads from cellulitis leads to sepsis, and I have several friends who are late stage, such as I am, who have passed away due to sepsis. It was especially scary during COVID because of the long ER waits. I have a very good doctor who does allow me to keep antibiotics on hand so I can take them as soon as I'm able to. But when cellulitis hits, and it hits very quickly, you're out. And even if I don't have to go to the hospital, going to the hospital just complicates things. The Metaport, I'm a hard IV stick. Then you're out of, when I was working, to have to go to the hospital, I was out of work. I actually do not have any children, and I'm okay with that now. But when I look back at my life, I was in my early 20s when, it took me to 24 to get diagnosed, but obviously I had this most of my life. I feel like it did rob some of my life, some of my opportunities. Of course, the silver lining to that is working on this bill to meeting Heather. I don't think the way I grew up, I would have ever met a former ballerina with twin boys. That we just, we don't have, that's our common thing is lymphedema, as well as many others. But not being able, it's not just not being able to properly manage the condition. It's like I had done doing all I can possibly do to manage it, and then to have this roadblock. And then your health, I'm thankful I have Medicare as a safety net, but, we talked to congressional offices and I've talked to CMS, and their eyes really light up when I say my health has gotten worse on Medicare. It's not supposed to be that way. And it's just, I feel like I'm always looking over my shoulder, wondering when cellulitis is going to hit me next, especially when it recurs every couple months. I'm like past due for it at this point. So every little twinge, every little pain, you know, I'm wondering if I'm going to develop a fever in a few weeks. I do have, though, because of my advocacy work, has really helped me emotionally, though, and socially. I have met a lot of people. I do have great friends and great family. I have friends who now tell me I recognize it in other people. I know what lymphedema is. I had a friend who say, hey, I was at the doctor today and my arms were being measured and I knew about lymphedema because of you. And I said, hey, why were your arms being measured at the doctor? And she said, oh, I didn't tell you I have breast cancer. And I said, yeah, you didn't tell me that. But I was so glad that she was aware and understood things because of me speaking out. And this brings a lot of purpose to my life, because I know a lot of people have a stereotype of people on disability, stereotype of people on Medicare at my age, or when I was on Medicaid. And I have a purpose. This gives me something to work forward to. And deep down, I kind of enjoy the fight a little too much. So
you are a powerful voice, very much like Heather, and your story resonates. Really keep up the tremendous advocacy work that you're doing. It's so very important. And again, I think we're so very close, and the work that you're doing is incredible. So thank you so much. Carrie, from a provider standpoint, you've worked on with a lot of cancer survivors. Can you tell us a bit more about how lymphedema has impacted their lives in a post-cancer treatment for survivorship?
Sure, Alex, thank you. Can you hear me okay? I'm not muted. Okay. So, for patients, what we hear from them is that all during treatment, they are incredibly supported from family, from caregivers, from the doctors, from the nurses, from the radiation therapists. They are very well taken care of, held close to the vest. We do everything we can to keep them out of the hospital. But then, we have this terrible long-term side effect that we have no idea who it's going to touch. And we can look at 10 patients and 2 of them will end up with it, and we don't know who or how to stop that from happening at this point. So they are feeling lost and alone. And, we get the treatment, we get them back to life, and then there's this incredible sadness because it touches every aspect of life. And it's expensive, mental health suffers, self-image suffers, it can affect work because if you're a breast cancer patient and you're bandaged and you can't move your arm, you can't drive sometimes to work. So it affects sexuality, just every aspect of life. And so that's a real sadness. And it's not something that is always gone into in depth before treatment, but nobody's going to say, don't treat me, I don't want to get lymphedema. It's just something we have to deal with on the back end. And this is just an oversight. I don't think Medicare intended in the spirit of Medicare to not cover this service. It's just a wrong that needs to be righted.
Thank you so much for that. And, we sort of chatted before the call started about how you and some colleagues went into some congressional offices and brought props, if you will, and dumped them on the table, both a Democratic office and a Republican office, and both congressional staffs were, you're, from a clinical standpoint, providing what this really means really made a difference. So that kind of advocacy work is tremendous and greatly appreciated. Valerie, with lymphedema so prevalent in the breast cancer community, and let me add that many of our audience members sent in comments in the chat that obviously it's not just breast cancer, it's many cancers that are involved, that lymphedema is part of that. So we certainly want to make that aware. But speaking certainly for Komen and breast cancer community, what are some of the effects lymphedema can have on health equity? You sort of touched upon this, but we're in that age where that is so very important.
Yeah, absolutely. And seconding what you said, of course, lymphedema impacts a broad spectrum of people. And as Carrie just said, it impacts a lot of different aspects of life. But I can speak at least to the breast cancer community on this. And I think the biggest takeaway here is that, lymphedema is a big issue for women's health. Even though we know that breast cancer impacts men and men can have breast cancer, it's often thought of as a women's health issue because of that disproportionate impact on women. Well, because of the prevalence of lymphedema in the breast cancer community, I do think that it should also qualify kind of as a women's health issue. More than that, though, it's also a health equity issue. And I did touch on this a little bit earlier, but I want to emphasize that, in this day and age, we want to be cognizant of a lot of the systemic disparities that we see in breast cancer. And I mentioned earlier that Black and Latino women are far more likely to develop breast cancer-related lymphedema than their white counterparts. But I really want to impress how much more likely that, Black women are 3.5 times more likely, and Hispanic women are more than twice as likely to develop breast cancer-related lymphedema as their white counterparts. And that's a huge contributor to kind of the disparate impact that breast cancer and breast cancer survivorship has on Black and Latino women. And as Carrie had mentioned, it kind of impacts every part of your life, but it can also impact every part of public health in that sense. So when we talk about taking just a bit of that burden away, just a teeny bit of the burden of breast cancer and breast cancer survivorship away in this sense, by covering the costs of necessary treatment equipment in Medicare, this can go a really long way, not only in an individual's journey with lymphedema on a micro level, but also kind of on a macro level, the overall impact diseases like breast cancer that, are closely tied to lymphedema can have on our country and our communities.
We couldn't agree more. Absolutely. I want to be conscious of the time, but Heather, I'm going to give you sort of the last word. And I've been seeing in the chat that a lot of folks have been asking questions and great responses from I see patient advocates and oncology nurses and others on links to go to. So, of course, we're at that critical moment to try to get as many advocates as possible to contact their legislators, both in the House and in the Senate. Anything, a quick line, hey, this bill is so important, it's important to me for whatever reasons, or the economics of it, as we've just heard, are driving force as well. Great to do that in ONS and Heather's group and Komen and the Lymphedema Treatment Advocacy Group, and so many others are involved in this. Lots of ways to go forward. So Heather, I will give you, Mom Champion, sort of the last question. As we've heard, lymphedema is not just caused by cancer. Can you elaborate on some of the other causes?
Absolutely. So basically, lymphedema can affect anyone at any age. The primary lymphedema, like my son has, is considered a rare disease. It affects about 1 in 100,000 children. It also commonly occurs with over 40 other rare diseases. So this issue is of importance to the rare disease community. But all of those cases of primary lymphedema put together only account for about 10% of the cases in the United States. So 90% of all lymphedema in the US is secondary lymphedema. And the most common cause, of course, is cancer treatments that remove or damage lymph nodes and vessels. So about 2/3 of all cases in the United States are cancer related. Other common causes for secondary lymphedema are venous insufficiency, obesity, and really any trauma, surgery, or illness that does permanent damage to your lymphatic system can result in lymphedema. So as you've already heard, cancer, for breast cancer, it has the highest incidence rate, about 40%, 2 out of every 5 women. And cancer overall affects about 15% of survivors. And as Valerie mentioned, the wonderful thing is that we have better survivorship, But the flip side of that is that we have more and more people living with lymphedema as more people survive cancer and live longer after cancer. And it's a common misconception that if you're going to get cancer-related lymphedema, it will happen right away. That's just simply not true. You are at lifetime risk. Most cases will occur within the first 5 years, but it can occur anytime for the rest of your life. I also lost a relative to breast cancer. My mother-in-law developed breast cancer-related lymphedema 10 years after her first diagnosis of breast cancer. So it really can come on at any time. And, you know, like I said, with increasing survivorship, we're just having more and more Americans living with this chronic disease, which makes it that much more urgent to close this coverage gap, both for those patients so that they can access the care that they need. And even if you don't know a patient, just from a taxpayer's perspective, this is a penny-wise, pound-foolish policy if there ever was one. We are paying far more in the long run to see these patients in the emergency room and pay for their hospital care rather than making sure that they have access to the preventative compression garments that can allow them to live healthy and full and productive lives. So especially, you know, I'll bring it back to my son. He's got a whole life ahead of him of needing to manage this condition. And that's why it was so important to me. I didn't want to just fight with my own insurance company and get his garments. I really felt like this is just something that had to be fixed. And so I'm so grateful to all of my fellow advocates, to all of our fellow organizations, to all of our congressional champions, and just the hundreds, literally hundreds and hundreds of offices who have stepped up to co-sponsor this bill and bring us to this point, which is hopefully near to the finish line. So if we have not, I've tried to address many of the questions that were coming through the chat as we were proceeding, but if I didn't get to any of them, this is my email address, and please do feel free to reach out to me at any time. And I'm just so grateful for everybody's time and attention here today.
Thank you, Heather. Really a phenomenal discussion. And we certainly want to recognize the tremendous leadership of Senator Cantwell and Senator Grassley and Congresswoman Schakowsky and Congressman Carter for their bipartisan, bicameral support of this piece of legislation that we hope to make it through. This has been an incredible session, and we thank all of you for your time and your expertise. For all the registrants, we will send out a recording in about a week. We'll also post this on the ONS website. ONS looks forward to the time when we can celebrate the signing of this important bipartisan legislation. We will continue, though, to work in the broadest coalitions to ensure its passage. Until then, stay tuned, and your help is so very critical in this. Thank you all very much.